Okay, well, hello everyone, and welcome to today's webinar panel on centering health in fiscal policies for fossil fuels. It's excellent to see everyone online, and I'm sure there's going to be a few more joining us, but for the matter of time, we'll kick off now. So my name's Geordan Shannon, and I'm welcoming you on behalf of United Health Futures. We formed as a global platform to respond to complex planetary health and societal challenges. United Health Futures is a team of academics, economists, technologists, and entrepreneurs with a particular focus on global health policy and a shared interest in finding practical solutions for people and the planet. As one of those solutions, and an area that we have led on in the past, has been health taxes. Health taxes are traditionally levied on products that have a negative public health impact, and the focus in the past has been alcohol, tobacco, and more recently, sugary sweetened beverages. But fossil fuels arguably belong here as a health harming good. So United Health Future, in the lead up to COP26, we saw the opportunity to really make the health case when advocating for fossil fuels and to reframe the discussion around fossil fuel taxes as a health issue. So I'm coming to you actually from Glasgow, and COP, as we know, is going to be starting in just a few days from now. There is a global recognition, thanks to decades of political action, that climate change is really the greatest threat to humanity and a health emergency. More recently, so much has been done to centre health in climate change discussions and to outline the impact of fossil fuels combustion on health. But what are the actions that countries can take? What are the policy levers? We think that centering health in discussions on fiscal policies that address fossil fuels, such as reducing subsidies or introducing taxes, is actually a really compelling political strategy that so far has been underexploited. So today we're really excited to bring together a global panel of experts who are really leaders in their respective fields, who can start outlining and building the case for fossil fuel taxes. Now, I'm going to hand over to Zahra Zeinali, who will be facilitating today's panel, and she'll be able to introduce each of our panelists and kick off discussions from there. So over to you, Zahra.
Thank you, Jordan. Hello, everyone, and thank you so much for joining us today. I will have the privilege of introducing our expert panel today and moderating the discussion. I myself am a global public health researcher with a background in medicine, and my research is focused in health policy, health systems, and social determinants of health. Our first panelist is Dr. Barrak Alahmad. He's a physician from Kuwait, a PhD candidate in population health sciences, specializing in environmental health at the Harvard T. Chan School of Public Health. And he's also a mission scholar from the Faculty of Public Health, Kuwait University. He holds a medical degree from the University of Liverpool, UK, and a Master of Public Health from the Johns Hopkins Bloomberg School of Public Health, with a concentration in global environmental sustainability and health. His current research focuses on air quality, climate change, and health in the Middle East, specifically the adverse impacts of dust storms and extreme temperatures. Welcome. Our next panelist is Ms. Lourdes Sanchez. She's a senior policy advisor and lead in the Indonesian hub of the International Institute for Sustainable Development. She's working in the energy program of the International Institute for Sustainable Development. And her research focuses on the analysis of energy subsidies, the evaluation and design of sustainable energy policies, and on developing communication strategies for energy subsidy reforms. She's worked in projects in Mexico, Guinea, Indonesia, China, and India. And prior to this role, she worked with energy utilities, developing pricing and supply side support mechanisms for renewable and energy efficiency. Lourdes holds a master's degree in electrical engineering, complemented by a specialized master's in energy management. Welcome. Our next panelist is Dr. Hanssen. He's a health economist currently working as a consultant within the Climate Change and Health Unit in the Health, Environment, and Climate Change Department at the WHO headquarters. Most of his career has been spent working on economic analysis within health, including driving several WHO flagship publications in health economics and financing, such as the WHO investment case, the global price tag for the health SDGs, and many more. And at the global level, he's been part of advancing research related to efficiency and value for money in health, common goods for health, and other areas. And his current project is working on developing a standard WHO approach to economic analysis of environmental health. Welcome on. Our next panelist is Mr. Neeshad Shafi. Neeshad is a young environmentalist, speaker, and policy-oriented social change advocate, best known for his work on environmental and climate change education, advocacy, and policy in the Gulf and Arab region in the Middle East. His core area of expertise includes analyzing global environmental politics, sustainability, and climate policies. He's an active civil society member and has been a prominent presence at international climate summits, including COPs, since 2015 in various capacities, including his role of education and civil society for climate action. He holds a master's degree in energy and environmental engineering and is based in Doha, Qatar. And in March 2019, he was named in the Apolitical's list of the 100 most influential people in climate policy. Welcome, Neeshad. And last but not least, we have Dr. Geordan Shannon from UHF, who's a medical doctor and academic at the Institute for Global Health, University College London. Much of her career has been dedicated to thinking critically about gender, health systems, and transformative, transdisciplinary, and transnational approaches to global health, with a strong emphasis on systems thinking, human-centered design, and participatory research. She was awarded the United Kingdom's Young Australian of the Year award in recognition of her oversight of community-led interventions for non-communicable diseases and violence prevention in Australia, Kenya, Peru, Sierra Leone, and the Republic of South Africa. Her current research takes a systems and design thinking approach to address broader ecosystems, failure in achieving human health and well-being in low resource settings worldwide. And she's also a board member of United Health Futures. So let's get started with the presentations. The first panelist who will be speaking for us today is Barrak, who will be outlining the health impacts of fossil fuel use, focusing on air pollution and climate change. Over to you, Barrak.
Thank you so much, Zahra, and I'm very happy and excited to be part of this panel here. Let me just give it my presentation to be on screen now. Okay. So I'm going to talk about air pollution, climate change, and health, and mainly focus on the health part, and the taxes part will come later with the other panelists. So when we talk about air pollution and health, and we specifically, just to set the stage, when we are talking about fossil fuel combustion, many people would focus on the carbon dioxide that comes out as a byproduct, which is the greenhouse gas, but there are a number of gaseous and particulate pollutants that are important byproducts from fossil fuel combustion. Of interest is the particulate matter, which has been extensively studied in the epidemiological research. This is all what you can see here is one particle from fossil fuel combustion. Now, let me tell you, it is a number of carbon cores. They're all agglomerating together, but then also they have an adsorbed hydrocarbon around them that attracts all sorts of different species. So you get sulfate species, you get more hydrocarbons, you get heavy metals. So when you inhale one particle just like this, you're not only getting the carbon, you're getting the carbon, the hydrocarbons, and all the species that is associated with it. But we don't inhale only one particle, we inhale a lot of concentration of these particles that come from fossil fuel combustion. So there has been a lot of research on the effects, the health effects of these particulate matter. So when we look at the toxicology or the pathophysiology, how this affects health, and these studies have been done in human and in animal studies, and we've seen a long list of things that are bad: oxidative stress, pulmonary and systemic inflammation, genotoxicity, the list goes on and on and on. And these things here in this box, they manifest into health effects. And the outcomes that I outlined here are the ones that have been studied by epidemiological studies. Some of them, I mean, there might be others that we did not even study yet, but these are serious ones: heart attacks, asthma, blood pressure, stroke, impaired lung function, arrhythmia, lung cancer. I also want to highlight this: low birth weight, preterm birth, small gestational age. All these are health effects have been associated with particulate matter. But we cannot not talk about climate change as well without talking about extreme heat. And we've seen an increase in frequency, we've seen an increase in magnitude and duration of heat waves. And the body, when it responds to heat, also has a lot of physiological changes. So we're talking about an effect on a decreased stroke volume, dehydration, a cardiovascular strain. We also see increased heart rate, drop in low blood pressure, vasodilation, could lead to critical organ failures. This has also been linked to health outcomes, mainly cardiovascular diseases, respiratory diseases, and other diseases like kidney, diabetes, has been linked to mental health and allergies. But there's one thing that I want to bring to attention with the panel here and probably with our audience, which is this outcome: it's mortality. And mortality is a very important outcome because it's the worst that you can get, but it's also very attractive in epidemiology because it's somewhat easier to ascertain, because you're either dead or you're not dead. But if you're trying to get an outcome that is somewhat different, then it's kind of hard to ascertain. So what are the studies that have been focusing on mortality and air pollution or heat? And one group of network that has been a collaborative network is the multi-country, multi-city, the MCC network, which I am part of. We have data from 700 cities, more than 40 countries, and about like 70 investigators from all these different countries. Now, I encourage everyone to look into the work that has been done by the MCC network, because the problem with previous studies in air pollution is that they've been done in separate cities around the world. And good luck trying to just link everything and just put them, studies use different study designs, others use different outcomes. But with this amount of data that we have, we can use unified protocol, unified analysis with all this data that has millions of deaths. Two papers I want to highlight really quickly. Particulate pollution mortality paper, this was in 2019. A 10 microgram per cubic meter increase in PM 2.5 increased all-cause mortality, cardiovascular mortality, and respiratory mortality. What's of interest is the exposure response, this curve between PM 2.5 and mortality. And good luck if you try to find a threshold where you can say anything below that threshold is considered safe for you to inhale the concentration of PM 2.5, because I cannot see that from this graph. The climate change induced heat paper as well showed that 37% of heat-related deaths were attributed to anthropogenic climate change. So I'm just going to wrap up and finish with this slide really quickly here. There are epidemiological gaps in areas where environmental exposures are already at extreme magnitudes. So I showed the map of the cities that contributed to these big studies that have unified protocols studying the effects of air pollution and heat. But you can see Africa, Middle East, and Southeast Asia, there is a lot of, chronic underrepresentation of the data from there. But we know that the exposures in these areas are quite at the extreme magnitude. We've seen air pollution in Kuwait City or in Delhi, or we even look into the future projections of temperatures in the Arabian Peninsula, and there have been questions on inhabitability actually by the end of the century with the extreme heat there. And with that, I'll stop my screen, and thank you so much.
Thank you very much. That was really fascinating and chilling in equal parts. I think the numbers that you just highlighted should be bigger news at this point. So moving on to Lourdes, who will be talking about estimates for health costs, externalities of fossil fuel use, and the opportunity cost of fossil fuel subsidies. Over to you, Lourdes.
Thank you very much, and thank you also to Barrak for the very interesting previous presentation. So yes, Zahra says I'm going to be talking numbers actually today, and numbers in terms of what is the cost of fossil fuels to society in the form of externalities, and also in terms, I mean, to taxpayers in the form of subsidies. Because one of the things that actually, well, we're here to talk about taxing fossil fuels. And indeed, there are many initiatives, as you all know, in terms of carbon pricing and so on. But one of the things that we also need to look at, and should be one of the main priorities when talking about establishing the right pricing of fossil fuels to external, or to reflect the real cost of society, is that there's something called also fossil fuel subsidies that act as a negative tax. And actually, when you put both together in terms of the current initiatives, overall, it comes that fossil fuels are more subsidized than actually taxed. So that's why I want to start presenting here what is the total value of the global value of fossil fuels subsidies in the past few years. So these are data compiled from the main organizations that produce fossil fuel subsidy data. So that means the OECD and the IEA mostly in this case. And then what we see is that in 2019, fossil fuel subsidies cost to taxpayers in the end over or almost $470 billion US. So this is a huge number that again acts as a negative tax to fossil fuels, divert public finance, and well, also creates significant externality cost. So when we think about, you know, this money could be also spent in other important public services or public areas. I mean, not only that is a huge number, but also we see that in several countries, the amount of public budget that is assigned to fossil fuel subsidies is bigger, or at least comparable to the amounts assigned to education or even health, for example. These are a bit old data from 2014, but still the reality keeps on being like that. Also, as I said, so there's a huge cost of externalities associated to the consumption of fossil fuels. And these are data coming from the IMF. And there we see that actually, if we add up the cost of externalities, considering the cost as that you know, from I mean, that associated to climate change or pollution, also what they call vehicle externalities. So that means road accidents or road use, etc. And also the revenue forgone. That means the taxes that are not collected because there's a subsidy. Then in total, the IMF estimates that in the latest year, so 2019, there's that cost around $6 trillion US. So again, this is a huge cost to society and in general, well, to taxpayers when we focus more on the subsidies part. So this is a complex topic, and that's why I want to bring a little bit more of clarity in terms of where are these subsidies going, so that it can also help the discussion in terms of taxation of fossil fuels. And I'm going to start looking at where actually most of these subsidies are going to. So again, I'm talking only about subsidies, not the externalities here. And here we see that most of subsidies that are today estimated or evaluated, they are going to petroleum products. So that means mostly gasoline and diesel for transport, but also other derivatives of petroleum. Also to highlight that coal seems is a very small number, but actually we have the whole bunch of electricity subsidies here. And, you know, sometimes it's hard to estimate or to disaggregate whether coal, because, you know, coal is mostly used to generate electricity. So sometimes it's hard to disaggregate the value of coal subsidies within the electricity. So actually, even if the figure looks like very small, there's a lot of coal hidden also in this yellow part that means electricity. Also, who is getting most of these subsidies? So according to current estimates, we see that most of the subsidies are going to lower the price of consumption of fossil fuels. But again, here there's a tricky part, and actually is that many subsidies to the production of fossil fuels are not estimated. So that they are identified, but we cannot put values there, basically because transparency is limited, and sometimes it's also hard to calculate and estimate those subsidies. But that's also a big thing that comes when we're thinking on taxing fossil fuels. It's like sometimes actually, and we're going to see in the next slide, basically there are already subsidies in the form of not taxing fossil fuels. So there's even a big opportunity there. And this is what I meant with the taxation. So when we look at where exactly or in which form these subsidies are given, we see that according to current estimates, again, most of the subsidies are in the form of what we call induced transfers. Induced transfers is basically support to the consumption prices. But we see that a big part, again, is going in the form of what we call tax expenditure. So that means missing taxes or lower taxes than what they should be. And as mentioned before, these are actually most likely or actually significantly underestimated, because sometimes, well, first, it's complicated to estimate what is the associated tax, because what is the tax benchmark that should apply to the production or consumption of fossil fuels? And second, because many measures is not very clear actually to which base the tax exemption should be applied. So that's why it's a mix of complexity in calculation and also transparency that makes that this number, even if it's today is around 30% of the equivalent of subsidies, actually is very likely to be much higher. And just to to kind of bring together the number or like some estimates on taxation and on fossil fuel subsidy reform. I mean, we've been doing some thinking at the International Institute for Sustainable Development, and actually to make it easier, considering all this complexity of fossil fuel subsidies, etc. Let's say that the low-hanging fruits in order to tax when it comes to fossil fuels and also reform the subsidies is to focus on transport fuels, so gasoline and diesel, and also coal for power generation. If we look at these fuels and we look first at what will be if we reform the subsidies, the consumer subsidies to these fuels, and also we implement some kind of or a modest tax increase, in total we see that per year we can raise up to $550 billion. And again, this is a figure by year based on average consumption levels before COVID. Just to highlight a little bit or to specify a little bit what is the tax increases that we foresee here. So for gasoline and diesel, the estimate is considering an increase of 12.5 cents US dollar per liter. And for coal, that will be around $5 per ton. So this is the equivalent of $40 per ton of CO2 for gasoline and diesel and $2 per ton of CO2 for coal, which are like reflecting kind of the either the most recent discussions, or in the case of coal, it's actually a low one, but well, will be like a starting point to learn about coal pricing, I mean, or pricing of let's say CO2. So this is my presentation. I'm happy to answer any question afterwards. Thank you.
Thank you, Lourdes. That was really interesting, and I think a very good introduction to the sort of the rest of the conversation we'll be having. And in the meantime, I'd like to remind our participants to use the Q&A function on Zoom, and either send their questions as the panelists are presenting, or wait for the end and then post their questions, because we've allocated a Q&A time and we'll be going through some of the questions. And with that, we'll move on to Odd, our next panelist, who will be giving us an overview about health taxes and how fossil fuel taxes can and should be considered health taxes, and the conversation on challenges on implementing reforms on these taxes. So over to you, Odd. Thank you.
Thank you so much. Before I get started, I just want to say that as I picked the background, I would be much more comfortable if I could be the one talking about numbers, but we passed over to Lourdes to lead us through the graphs and the numbers side. So I'll instead try to talk about more the theory or the motivation behind this idea. So Geordan gave us a quick introduction earlier on what health taxes are. So in general, in a quick summary, a health tax is something that is an additional cost on the sale of goods that have a negative impact, particularly on people's health. Now, the idea is that if you raise the price of something, someone is going to be susceptible to that increase in price and consume less of it or not consume it at all. So by changing the price mechanism, by changing the price of something, we're changing people's behaviors and therefore changing their health as well. Now, another side to health taxes are that they raise revenues for the government to use. And as a result, the government having more revenues allows them to then spend more on health. So indirectly, a health tax also contributes to more health spending and therefore also improves health outcomes. More often than not, health taxes are what are known as excise taxes, meaning that they're levied or they're made to be paid on the product when it's either brought into a country or when it's produced. And the biggest sort of health taxes in the world are on tobacco, alcohol, sugar sweetened beverage taxes, and in a few countries also on saturated fats and trans fats, or ultra processed foods or meat particularly. Another sort of important aspect on taxes has to do with how they're raised. So World Bank report noted that it's easier to raise or to gather excise taxes than it is to raise or pick up income taxes or value added tax. So instead of collecting something on its sale, it's then levied on its purchase. And so even when we think about the ones that are easy to collect, being income taxes or VAT, the general consensus is that this kind of tax is even easier to raise or to collect by the government. And linking to sort of the wider health sphere of what interventions are good or not, health taxes are known as being cost effective, particularly cost effective, which means that they have a big impact on improving people's health, but don't cost much more to governments themselves to implement. You can either choose to prevent, say, lung cancers or cardiovascular disease that Barrak mentioned earlier, which don't cost much money through this, like imposing taxes, or you can choose to treat them, which then afterwards have a much lower impact on people's health, but also cost much more, and so therefore have a much lower cost effectiveness. So health taxes in themselves are accepted as a very cost effective intervention. Now, fossil fuel taxes generally have a slightly different motivation in most places. They're implemented generally because of their impact on the environment. Countries put taxes on fuels and combustion of fuels because it contributes to having cleaner air. In many other places, they are sort of a bedrock of a source of financing for governments. Now, the idea, as I sort of talked about a little bit before, was if you have higher prices, both producers and consumers will start to consider alternatives. And the idea is either through producers changing priorities or consumers changing priorities, you'll end up seeing an impact on the 8 million approximate deaths a year from air pollution. And also, as Barrak mentioned, since the burning of fossil fuels are the main driver of climate change, if we implement more taxes on fossil fuels, you're also going to have a positive health impact through the smaller impact of the size of climate change that happens in the future. Now, perhaps the most interesting bit, in my opinion, is if these things are so great, why is it that there isn't high taxes on fossil fuels everywhere? So like health taxes, there are some sort of standard challenges to implementation. And the first, which we can draw from thinking about tobacco and alcohol, is that the industries behind these products are particularly powerful. They have strong influence through lobbying and also through consumers themselves. Tobacco, alcohol advertisements have created a strong consumer base, and that therefore will have some opposition to having to pay more for their prices. And similarly, the same industry, but others maybe from outside, will sort of say that there are reasons why we shouldn't have these taxes, that these impact more certain people than others that maybe are already kind of poorly off, and that perhaps by putting taxes, the consumption will then shift either to other places where there isn't taxes, or lead to people to what's called engage in illicit trade. So buying things illegally where the taxes are not imposed on them or they're not taken up. And generally talking about sort of raising public opinion against them because no one really likes paying taxes. And it's especially when the case is that you don't know what these taxes are going to go for. If you'll say, why should we pay more taxes if we're not sure that they're not just going to go into a politician's pocket? So these are sort of what health taxes in general have always had challenges or opposition to in the implementation, and they apply to fossil fuels as well. However, there are a few things that are unusual about fossil fuels. First off, there is no other area that has a subsidy as opposed to a tax. So countries already have created a relationship with people that people sort of expect to have a right to consume fossil fuels below the price that the market would set it as. And so you are talking about creating a change in this relationship that people have with this product that they have developed over time. Like the other sectors, there's a lot of power and influence within the industry, with the fossil fuel industry. So if you think about the power of tobacco, just think about how much more power the fossil fuel industry will have. But very uniquely, fossil fuels themselves are not just something that people consume. They are also something that goes into the other things that are being made, or other services or other jobs that people do. So it isn't just alcohol that's consumed, but fuel that then goes into a factory that is used to make other things, or fuel that goes into a car for people who drive cars or trucks for a living. So the people affected by this are, for their livelihoods, are much more. And then similarly, everyone practically consumes fossil fuels. So a tax affects everyone. You can sort of think of the taxes on tobacco. Most people that are not smokers don't think about it because it doesn't affect them, but practically everyone is going to be affected by a fossil fuel tax. So the sort of the opposition then is much wider, much broader than with some of the other health taxes. So the idea is to bring this about, we really need to change the discussion about fossil fuel taxes or cutting subsidies as something that is done not just for the environment, which is good in itself, but for the value of health, for improving everyone's health. And that these messages of them being regressive are only on who pays. But the truth most often of the time is with subsidies are actually regressive themselves. The more well-off tend to benefit more from subsidies. And then the outcomes in terms of who benefits from the health improvements and who benefits from government spending that comes from money raised from fossil fuels is progressive rather than regressive. And the idea that it really needs to help make this a viable idea or viable interpretation is to sell the idea that the taxes are not just being raised to go into government coffers, but we will raise taxes which will improve your health. And those taxes themselves will then also go into improving your health through more spending on healthcare. And then finally, as with any tax or with any measure, there's going to be some people that are being made worse off than they were before. And to help sort of transition and make this sort of more viable, there's an important consideration to having some kind of mechanisms, temporary mechanisms, to help support and compensate those that have been most impacted by these new reforms. With that, I'll wrap up and pass the word back to you. Thank you.
Thank you, Odd. That was really fascinating, comparing the subsidies to the tax and the sort of policy challenges that this creates. For our last presentation, something to inspire us to act more quickly on everything that we've been talking about, I'll turn to Neeshad, who will be speaking on how these policies can be implemented and how we can ensure that this is put on the political agenda with a special focus on COP26. Over to you, Neeshad.
Thank you, Zahra. I mean, our fellow panelists have put all the context and the numbers on space. I mean, I would only add the part where implementation requires the challenges also been mentioned by Odd in his last presentation. So that gives me all the space where sort of young people pushing the government to make necessary changes at the policy level. Like always in the tobacco companies, who always use the levy of taxation, which is public money, and of course it has been always a way how the fossil fuel industry is also working at this point of time. Given the fact, all the youth movements have been focusing on health since the pandemic, it has shown how vulnerable our health is. Given the climate change, that would be more exaggerated beyond what we comprehend. So there's been a great sort of support within the youth community, given the fact in the past Youth Climate Summit, which was in Milan, where I was there for 4 days. One of the serious issues was health education and how to remove fossil fuel subsidies. It is not easy, like how Odd already mentioned. The lobbying power of fossil fuel industries is huge. We just saw one of the example I would share, the recent TED event in Edinburgh. We had the Shell head on the panel with the youth activist, and they were claiming to be net zero and blah, blah, blah stuff were happening. And she directly questioned the CEO of Shell that you've been announcing those big numbers, but what quite you're doing on the bottom of the chart is that you are exploiting people and using some of the countries that leave you to more subsidies. And he started answering, telling that it's not we who are pushing, it's the government. So that's so the synergy of how governments and this huge lobbying fossil fuel industries work. So there is a huge push from the youth communities for removing these subsidies to fossil fuel industries and not go with how the tobacco industry to sell themselves. Now you can see a lot of fossil fuel companies showing ads that are very much similar to tobacco companies, like, hey, we are doing this, but at the same time we are doing this to help you protect your health at the same time. So they're using this as a leverage to get those subsidies taken and also exploit. And those only, so with the push is all not only that, the impact of climate change is not only going to be a physical thing which you would see during the extreme weather events, but also the health cost. So one of the key outcome and recommendation was part of the Youth for Climate Summit in Milan was to how to value that health impacts in terms of value. And there was a huge discussion happening. And of course, they said we should put taxation on fossil fuel industry, and it has to be double than what they pay as a subsidy. So it was quite great discussion to see from young people to have that push for changes to fossil fuel subsidies. And just to give an example from the Middle East and Gulf perspective, most of the fossil fuel countries here in part of the Middle East and the Gulf countries especially, we get all the fossil fuel subsidized. Everything is subsidized, either it is alcohol or any other items you buy here is subsidized. Of course, like how Odd mentioned, is the fuel that is run the car. I mean, I'm also responsible because I use those cars, but it's run on a very cheap fuel. So why will I go to a tram or a truck where it is a bit real more than my car, because I can go on my own luxury and my own people together, rather take a public transportation. The cost is almost similar because our fuels are super subsidized. Then comes the campaign we did back in 2019 before the COVID, was when Qatar and the Gulf countries also introduced hike in the smoking, the shisha, and sugar water. And people started, why was this put on to us? Because most of the people, as you know, in the Gulf and the region, they smoke shishas or a hookah, what do you call in your part of the world. And suddenly people realized that's because health, it's a health tax. Then people started, why not on the fossil fuel industries? They'll have a larger levy to do. Why don't you remove taxation on the local consumption at least? Okay, we don't have much to do when it is taken out for a global market. At least for the local market, can we have that? So people really look into alternate transportation, because the country already has a beautiful, metros and public transportation, which are very efficient, but people don't use this. People are very easy to go on their own cars and multiple cars. So that was a campaign done in back I just wanted to share. And also recently we launched a carbon footprint app to showcase people that how much your impact on the environment, and that has to do with the CO2 emissions. So this app was recently launched with support of Ministry of Public Health, who also wanted to do a study with us on the health impacts of air pollution. Yes, there have been quite a lot of studies done, but sectoral studies like, okay, we know health impacts of air pollution on people as general, what that to do in Doha, are people living close to them, fossil fuel industries as such. So this study would be done in early 2022, and that also there's a book push from our organization with the Ministry of Public Health to come up with study, because at the moment there is not exact studies what it happens, unlike your medical profession. Yes, we have found this study has to do this and this. What are the specific impact of health on a community, especially blue collar workers who lives in much of the Gulf countries, who are prone to these sites and who are mostly outdoor. So this would be a study we would be doing, and we would be doing targeted campaigns how to levy on removing taxes. Of course, unlike Western democracy, it's very hard to have those changes here. It has to only come through health professional who would stamp that this is going to impact the citizens and communities living in these countries beyond fossil fuel lobbies. So I hope there has been quite an extensive discussion, but actions are very limited beyond the global discussion. And also at the COP, WHO is hosting a special panel on health and climate change. I hope this would be an opening discussion for more countries to push for taxation. So yeah, that's my small comment.
Thank you so much, Neeshad. Very, very interesting insights that you're sharing specifically from the Middle East region. I'll turn to Geordan, who will deliver some overview and closing remarks of the panel before we move on to the Q&A. And I still encourage everybody to share their questions in the Q&A box. Over to you, Geordan.
Thank you, Zahra, and I see some excellent questions coming in. So let me make this brief. I just want to turn now to the COP26 agenda specifically, and there are some really critical objectives here on the table to secure net zero by mid-century and keep 1.5 degrees within reach, and to adapt and protect communities and natural habitats to the impact of climate change. So in order to do this, what do we turn to? Well, that is all about finance, mobilizing and unleashing finance. So there's an imperative on the table for particularly developed countries to raise $100 billion annually to address these political objectives. Now that sounds like a lot of money, but as we've seen from our panelists' contributions today, it dwarfs in comparison to the externalities of the health impact of fossil fuel combustion, and also the way in which we are currently subsidizing the use of fossil fuels. And that's even before we start to think about the benefits of tax. So as Lourdes outlined, there are huge direct subsidies. We're paying $468 billion directly to fossil fuels, as well as the externalities that are costing our community and society over around $6 trillion. The low-hanging fruits that we can actually target now are transport, gasoline and diesel, and power, coal, and that can raise over $550 billion a year. Now, the solution here is in numbers, but how do we translate this into effective policy? Well, we need to start by telling a really compelling policy story. So what does that story look like? Well, fossil fuel use, we know, drives air pollution and climate change, and both of which have serious health consequences. Barrak has outlined the health impacts, and Neeshad has highlighted the fact that now there is a global focus on health driven by the COVID pandemic, amongst other things. So ending fossil fuel subsidies and implementing fossil fuel taxes, we know, curb fossil fuel consumption and production, but the impact of these policies on health has only just been recognized. So Lourdes has outlined some really important insights from the fiscal policy space on the impact of doing so. And we know that by removing fossil fuel subsidies, we could reduce over half the deaths due to air pollution, which is one of the leading causes of the burden disease globally, amongst other things. So we have some really hard-hitting tools that are within our use that can be harnessed, not only for the environment, for health. But fiscal reforms are not without substantial challenges. We've seen that from the health tax space. Odd has outlined some of the challenges, but we have particularly powerful industry and social opposition when it comes to fossil fuels. So the industry related to fossil fuels is huge. Fossil fuel reserves are valued at $39 trillion. And in addition, there's estimated to be another $32 trillion of fixed assets related to propping up that industry. In addition, a quarter of the global stock market and half the global corporate traded bond market are linked to the fossil fuel system too. So it is huge, but it is a system on decline. And we have a particular window of opportunity now to act. And I think we have to go, as we've recognized, beyond the environmental discussion to health. So where next? Well, there's an opportunity to reframe fossil fuel policy as a health initiative that simultaneously combats the negative health impact of air pollution as well as climate change. Now, the policy agenda window is here, but it's complex. And we know that evidence is important, but beyond it, it comes down to politics. And to start with, political action requires palatable policy messaging. So let's shift the focus from not only the environment, but towards people. And we can do that through focusing on health. We know that from our experiences in health tax arena, that health taxes lead not only to a healthier population, but a more productive and wealthier population, which is great for the economy. Health taxes raise revenue, which then, as Odd outlined, can be reinvested in really important public goods. So let's continue the discussion. Let's. I think our panelists have outlaid a really compelling case, and let's look at not only shaping the policy agenda window, but telling this compelling policy story that centers not only the environment, but health in the agenda. So I'll hand back over to Zahra to facilitate a Q&A session. Over to you.
Thank you. I'll try to ask a couple of questions in this remaining 10 minutes from our panelists to hear from different perspectives. So I'll start again with Barrak. And recently the Lancet Countdown report was published. And I want to hear from you, given the Lancet Countdown report and the health and fossil fuel agenda that we've been all talking about today, what are the next steps that you think collectively we should be taking and where we should be headed? Thank you.
Thanks, Zahra. So how many Lancet Countdown reports do we need? Now it's the 2021. Last year was the 2020, and the next year is going to be another Lancet Countdown. And I like the reports because it shows some effects that are not really usually covered in epidemiological studies, like the hard hit morbidity and mortality, because they talk about lost hours and things like that. So I think we do have a compelling case for the health effects. I think we should move next now to what Geordan, Odd, Neeshad, and Lourdes have been talking about. Let's move towards the policy. Let's move toward making an influence.
Thank you so much. The next question, I think I'll pose this question to Odd. It's from our participants, and it says, is there a global estimate of the economic benefit of fossil fuel taxes?
Sure. So I'm quite certain that there isn't anything that has been done to that level. It wouldn't be a huge difficulty to do that, but you would be, I guess, you would need a target. How much of a fossil fuel tax should you have, where countries are now, and then an expected change from that tax to be. So you could probably get from sort of an effectiveness study of how much raising a tax will lead to lowering emissions, and from that, how much lives you will save, and then translating those lives into an economic benefit. I think it's more likely that what you have today is fossil fuel taxes have this much cost in terms of the lives that are currently attributable to emissions from fossil fuels. But it wouldn't be a gigantic having to change and create new methods to go from that to an estimate of the current benefits that you would get from moving to sort of a standard global tax on fossil fuels.
Thank you. Thank you so much. I think I'll ask the next question from Lourdes. So the question says, elimination of the producer subsidies in the form of direct market support and or tax expenditure benefiting producers seems like a low-hanging fruit here. Does that seem right to you as well? And what would you add to this?
Yeah, thank you for the question. So indeed, it's not only a low-hanging fruit, but also it's a huge opportunity there. Because indeed, I mean, as I showed, most of the subsidies that are estimated today are in the form of consumption subsidies, which are very easy to estimate because you just know what is international price and the local price, and then you just throw the difference. But indeed, there's a lot of support to the production still. And as it's mentioned, mostly in the form of tax exemptions or lower tax rates, etc., that they still can be tackled. And actually, that is going to send a right signal to the production, which, is another way of tackling the problem. So if you okay, you can work out on the consumption, so try to lower consumption, but also, you know, if the supply becomes more expensive, let's say, then obviously there's a higher room for development of renewables and other sources that have much less externality cost and, of course, cost to health, etc. Now, what's the challenge? I mean, again, transparency. In many cases, it's not easy to estimate what the actual subsidies or like the actual tax revenues could be, and also the fact that, you know, there's a lot of discussion around what is called the tax benchmark. That means what should be the right tax. And, you know, with consumption can be easier because of, let's say, the externalities. So you burn fossil fuels and that has this impact on health, etc. But with production can be trickier, although why not? And also, well, the challenge there as well is, I guess, similar to tobacco, you are dealing there with the big corporations and sometimes the state-owned companies and a lot of politics in there, which makes the whole treatment of that kind of subsidy or that kind of, taxation much trickier. But definitely, I mean, that could be a great solution. So, yeah.
Thank you. That's very encouraging to hear. The next question I'll ask Neeshad. It's an interesting example from one of our participants who says about 75% of government revenues in Saudi Arabia comes from petroleum exports. How can Gulf countries gear up for the energy transition so they eventually don't fall off the cliff of the declining use of fossil fuels?
Well, hopefully that would be the case, but at the moment, the global requirement for oil and gas has been extremely high, and the market price is still governed by the OPEC countries. So I hope the cliff should be coming as soon as possible, as this oil producer will be keep on pumping oil to the global market, because of course there is a demand. I mean, I just read a report the other day, there are like almost 60 huge gas container ships awaiting Qatar's waters to take gas away to Asian countries. That's a huge amount of countries, you know, lining up. I mean, when we are talking about energy transition, we also have to come to see how some of the countries in the Asia do need the leverage of these fuels, as long as it has to sustain or get technologies that can be given to them to move away from fossil fuel dependence. At the moment, they are not having those discussions. Also, when you talk about the climate fund, which has to be given to the developing nations, again, definition of developing nations is also relative here, I don't know. But that has to be done at the same time, because if you are not doing the transition in what we call the just transition, some of the countries would be in the dark ages again. But that is why the climate fund is absolutely necessary for the developing countries to be provided in order for them to move away from the fossil fuel based running of their power consumption or transportation. If that is not done, I don't think you just have to blame Saudi Arabia or other countries, because the local consumption is the lowest compared to any other country in the world. But much of their emissions comes from the global market or global consumption, which they are supplying outside of their national boundaries. All the Gulf countries out of UAE, Saudi, and Bahrain, who just announced their net zero, is all about their local consumption. People are getting crazy. Sometimes they didn't read the report completely. It's not they're going to stop oil and gas. It's only the net zero to all the emissions coming out internally is going to be net zero by 2050 for UAE and Saudi and Bahrain by 2060. So people are in the mind like, it's like, hey, we are decarbonizing 100%. No, as long as there is a global demand, oil and gas would be still pumped. So the biggest way to do that, like the cliff has to come closer. The demand has to reduce drastically. As long as then the oil giants would be playing a crucial role and the lobbying would be the same, like Odd mentioned, it would be absolutely difficult to get away, because still we have tobaccos used frequently. People die even though they don't care, because it's been used in a very extensive manner in our life. It became part of our life. So the bigger picture is that, you know, as long as the demand is generated, the oil and gas industry still work. So what we have to do is to empower those countries to move or transition faster than these countries, because if you look at the UAE's and Qatar's vision, their transition and net zero ideas are very creative and interesting to read. Of course, they can do it in a much faster phase than any other countries, being rich and having a great sovereign wealth of their own. But the problem is those countries who are depending on them doesn't have those infrastructure. So as long as that is not done, I think that transition will be very difficult.
Thank you. Thank you so much, Neeshad. And I will pose the very last question to Geordan, sort of to answer the question and close the panel. And before that, I want to thank all the participants for their time and all our panelists for their expert opinion. Very fascinating conversation, in my opinion, at least. So Geordan, the next question is quite interesting. What lessons would you apply from the COVID vaccine rollout, where the vaccine is positive to health and economic impact, and yet inspires such resistance? How could health taxes applied to fossil fuels take lessons from that experience to encourage wider acceptance? Thank you, and over to you.
Thank you, Zahra. So yeah, that is an excellent question, and something that we have been able to reflect on over many Zoom calls during the pandemic. I mean, what we see with a number of resistance when it comes to either health taxes more generally or to particular public health initiatives such as vaccine is that it's complex. It requires a multi-faceted approach, one that is centered on effective communication. So as I said before, it comes down to telling a really compelling story and making sure that there is consistency in political messages at the highest level. It's not going to go as far as tackling all resistance to this, but I think starting with that really unifying story is essential. The next thing, when it comes to health, I think we have to think about incentivize the incentives that individuals and communities what are important to them. And so not only is it the out-of-pocket cost that you might face at the pump that is spurring people into resisting policies, but what's the flip side? What's the carrot versus the stick? The carrot here is health, and we have to make that visible. I saw another excellent question that came in from the webinar participants about that too. How do we make visible to our society the impact of health taxes and taxes on fossil fuels? One of the ways we can do that is actually starting at the proximal end of this discussion, which is air pollution. And so air pollution doesn't have the word fossil fuel in it, really doesn't have the word climate change in it, yet it is an essential link in the path. And so if we actually look at green city initiatives that focus on reducing the harmful impact of of air pollution, for example, that reframes the discussion yet allows for effective action. So some insights, but a particularly challenging area and a particularly interesting question. Thank you. So as Zahra said, I was going to take that last question and also conclude today's panel. Firstly, to say thank you to everyone who's joined. It's a really unique and I think innovative space, and something that has been to date really underdeveloped as a policy agenda, and it's something that United Health Futures, I know Odd and his department and others are particularly interested in developing further. And so I'd like to encourage you to continue the conversation with us. Ways that you can do that involved joining us on social media, checking out our website uhf.ch, and joining our newsletter. We're going to be publishing some follow-up from this webinar, and we've also got some really compelling blog pieces and policy briefs that you can access right here and right now to take this discussion even further. But I do hope that this is very much the start of something bigger, and I want to say thank you on behalf of United Health Futures to each of our panelists. You've shared a tremendous amount of insight and expertise from your respective fields on this issue. And I think we're able to really piece together that link between health and fossil fuels and fossil fuel fiscal instruments and the political agenda. And really excited to see what comes over the next 2 weeks of COP. And as I said, let this just be the start of something much larger to build on the momentum that we have. Thank you everyone for joining.